Hello everyone. In this video, we are going to continue the discussion on pathogenesis. So we are introducing a new disorder of the body fluid. So we have mentioned that in the essence, this category, the essence, the qi, blood, and body fluid. So when we talk about these disorders, we always separate them into the deficiency and also the movement disorders. So same as here, when we talk about the body fluid, we're also going to separate them into body fluid deficiency as well as the movements of the body fluid, which reflects in the formation, distribution, exertion of the body fluids in the body. So before we talk about the deficiency, we're going to have a quick revision on the body fluid metabolism in the body. Body fluid metabolism in the body is actually quite a complicated process. This because multiple organs have involved in this process, such as the lung, the dispersing function of the lung, the qi regulation of the liver, the transportation of the spleen, as well as the kidney, the blood, and also sanjiao. Do you still remember what is sanjiao? What's the function of the sanjiao? So the sanjiao is considered as the pathway of the qi, blood, body fluid. So that's where the body fluid travels. So as you can see from here, multiple organs have involved in this process. And from all these organs, the function of the lung, the spleen, and the kidney are most important in this process, especially refers to the qi regulation. Because the movement of the body fluid need to rely on the qi movement. That's the same as the blood movement. We need a qi to push the blood. Same as here, we need a qi to push the body fluid. We need a qi to assist the body fluid metabolism. So the first is the body fluid deficiency. The body fluid deficiency refers to the volume of the body fluid in the body is not enough. So we don't have enough body fluid in the body. And the signs or symptoms of this situation is that dryness. That's because the body fluid is the liquid in our body. If we don't have enough liquid, we're going to feel dry, but this dryness can happen in anywhere, such as the picture on the right side. You can see the lips, the dry lips from here. You also can see the tongue, although this tongue the color is red but dry on top. These two as well, they are dry coating. So these are some of the symptoms and signs of the dryness in the body. Also, the body fluid deficiency, it mainly refers to the dryness. The dryness in the organs, you can have the dysfunction, such as the dryness in the lung. The patient will have cough, dry cough. There's also the body fluid deficiency. The causes of the body fluid deficiency. The first is the heat. So we got extra heat in the body. The heat will consume the body fluid. This is very similar to the situation of the blood. So if we got the blood heat, the heat will concentrate the blood and then cause blood deficiency in terms of the volume of the blood. Here, same situation. If we got extra heat in the body, we will have body fluid deficiency. in terms of the volume, that's because the heat can concentrate the body fluid. So the heat came from internal, which we are going to talk in the next video, the 5 internal evils. The heat also came from external, which is from the exogenous pathogens. The second reason of body fluid deficiency can be the excess discharging. The excess discharging or exertion may be some of the symptoms such as severe diarrhea, frequent urination or excess urination, severe sweat, or vomiting. In some conditions, or such as the burnt from the fire. So these causes can result in the body fluid deficiency. The last cause of the deficiency can be similar to the blood. So we need to think about where does the body fluid come from, which is the acquired qi. So if the acquired qi is not enough, the patient will have the body fluid deficiency as well. So from these 3 causes, 2 of them are from the consumption of the body fluid, either from heat or excess exertion. One is from the source. If we don't have enough acquired qi, the formation of the body fluid is not enough. Also will result in the body fluid deficiency. So the most common symptoms is the dryness. The dryness can be on the skin, also can be the organs. If in organs, we can have different symptoms. Many reflect in the dysfunction of the organs. Also, the body fluid deficiency can reflect in such as the muscles. If we don't have enough body fluid in the muscles, what kinds of symptoms can we experience? The patient may be spasm. They may have muscular spasm, or the patient may have like stiffness of the muscle because the muscle doesn't have enough body fluid to nourish. In this situation, it's very similar to on the ground when the soil is very dry, the soil is very hard. So it's similar to our muscles. If we don't have enough body fluids in the muscles is going to be dry, going to be hard. That's the stiffness or even spasm. The patient also may feel thirsty. That's due to the fluid deficiency. The second is the disorder of the body fluid distribution and exertion. So in order to discuss this session, we need to revise the process of the body fluid distribution. What's the process of the distribution and exertion? Or which organs can affect this process? So firstly is the lung. The dispersing function of the lung, if it doesn't perform well, we will have the dispersing function disorder and cause the different organs lack of body fluid. The second is the spleen and stomach, which are the middle jiao. So this is where the acquired qi come from, where the source of the body fluid come from. So if the disorder of the spleen and stomach, we will lack of the source. So we don't have enough body fluids in the body. Also, if the sanjiao is blocked, so which is the pathway is blocked. If the pathway blocked, the transportation, distribution of the body fluids will be problem. So all these can affect the body fluid distribution and exertion, as well as the liver. The liver regulates qi, the regulation of qi. So if the liver doesn't function well, the qi regulation won't function well. This also will affect the distribution and exertion of the body fluid. When we talk about the exertion of the body fluid, this is mainly refers to sweating and urine. So these two parts are the most important exertion method. So when we say exertion disorder, mainly refers to these two, although from stool, the one aspect. That's why from diarrhea, we also can cause the body fluid deficiency. But more importantly is the sweat or urine, such as if patient have excess sweating or the urine also will cause body fluid deficiency. Or if the sweat or urine doesn't go out, if the fluid doesn't go to the bladder and go to the other areas, it will result in edema. That's the water retention in the body. So for this session, the disorder of the body fluid distribution and exertion mainly refers the blockage, mainly refers to the below theory, the dampness, the phlegm, and water retention. The dampness, how do we know there's dampness in the body and cause the disorder of distribution? In this course, we can see that the patient, the dampness, that's due to the reason that the spleen like dryness and dislike dampness. So the spleen, the dampness affect the body will affect the spleen directly, will cause the dysfunction of the spleen. And in this situation, the spleen loses the function of transportation and transformation of the body fluids. And then these body fluids, this water we drink or from the water from the food, will accumulate in the spleen, and when it accumulates, it will cause dampness. The reason how it causes dampness, we're going to discuss in the next video for the internal 5 evils. So that's the dampness from the spleen dysfunction can block the distribution of body fluid. And the symptoms of this dampness can be like chest pressure, distending abdomen, nausea, loose stool, or greasy coating on the tongue. So that's the dampness. The patient also can be vomiting. That's the more severe than nausea. The second is the phlegm. The phlegm, we also need to understand the metabolism of the phlegm. Where does it come from? Where does phlegm store? So that's the question for you. You need to find out where does the phlegm come from and where does the phlegm store. Once the phlegm stores in somewhere, or once the phlegm block in the meridian or the organs, it will cause the blockage of the pathways or of the qi movements that will result in different symptoms. If the phlegm stays in the lung, then it will cause cough, difficulty breathing, or even cough a lot of phlegm. The last aspect is the water retention. The water retention is directly related to the metabolism of the body fluid. That's related to the lung, spleen, kidney, and liver. In terms of the qi movement, where does the qi come from? How does the qi help the body fluid distribution and exertion? So if these organs function got problems, we got disorder of these functions, the water metabolism will also be dysfunction. So the water in the body is supposed to go to the bladder, but they go to the legs, which causes edema. The body fluid supposed to sweat, but it stays in the abdomen or under the skin. It causes edema. So this edema is the direct result for the disorder of fluid distribution. You see that the edema can block the pathway of the qi movement. So that's the next question we're going to discuss. What's the relationship between the disorder of body fluid and qi blood? The first is the water retention will block the qi movement. This is very similar to the blood stasis block qi movement. No matter blood or the water in the body, they are physical substance. They're going to, if they stay in the area where they are not supposed to be there, it will cause the blockage of the pathway. It's very similar that you block the highway, so all the cars who travels in the highways will be blocked. So the first is the water retention called qi blockage. In this situation, the patient may feel, depends on which organs affected. If affected in the lung, the patient may have cough, difficulty breathing, oppressed chest. If it happens in the heart, the patient may feel palpitation, chest pain. And when we talk about chest pain, then you will understand that for chest pain, in Chinese medicine and in acupuncture, we actually consider many different kinds of causes, such as the blood stasis. Now we talk about the water retention or abnormal body fluid movement affect the heart. So for the chest pain, the treatments we will distinguish from the blood stasis or water retention. The treatments will be different due to different causes. If the water retention stays in the middle jiao, which is the spleen, it will cause the spleen dysfunction, and then it will cause the transportation and transformation function disorder. The patient may feel headache or heaviness in the head, and distending feeling in the abdomen, or poor appetite. If the water retention block in the meridians in the legs, the patient we can see the edema in the legs directly. The second relation between this fluid and qi is the qi collapse due to excess exertion of body fluid. This is very similar to the qi collapse due to hemorrhage. Severe body fluid exertion will lose too much body fluids in a very short time will cause qi collapse. That's because of the relationship between the body fluid and the qi. The body fluid is the carrier of the qi. This function is very similar to the blood. So if we lose too much body fluid in a very short period of time, this body fluid will carry some of the qi, which we will lose in the meantime with the body fluid. So we will have qi deficiency. If we lose too much of qi, severe qi deficiency, then we cause qi collapse. Okay, so that's the second relation. The third, body fluid deficiency with blood deficiency or blood dryness. The blood dryness and blood deficiency are quite similar. They are not really similar, but they are related because the dryness also refers to the blood deficiency. The dryness is one of the results of the blood deficiency. The reason of these two happened together, the body fluid and the blood deficiency, is because the source of these two are the same. They can mutually generate in each other. And when we talk about the internal 5 evils in the next video, you will see that they can cause the wind, such as the blood deficiency, which will make the body fluids even worse. That's because the wind will dry the air. That's very similar. You see what they like, especially in the shopping mall, when the workers they mop the floor. Then the floor become wet. What they are going to do, they use a fan to blow on the floor. You make the floor dry quicker. You see, the wind can cause dryness, the wind can help to reduce the body fluid in the body. So the blood dryness can cause the wind, which also will result in the body fluid deficiency. So in the next video, we're going to study where does the internal wind come from. The next relationship is the body fluid deficiency cause blood stasis. This situation is because we don't have enough body fluid. In the same time, we also will have blood deficiency. That's because they are coming from one source. From one source, you won't expect that if we have body fluid deficiency and then you have excess blood, that's not impossible. Sorry, that's not possible. It's because from the same source, if we have blood fluid deficiency, which means we don't have enough source to generate into fluid. On the other hand, we also don't have enough source to generate into blood. Also, if the deficiency is from the blood, the heat, but also the heat also will affect the blood. So that's the same situation. That's why the blood and the body fluid always happen together. The fluid deficiency will result in blood deficiency. The last relationship in these two, the blood and fluid, is the disorder of the fluid distribution due to blood stasis. This situation is because the pathways of where the fluid distributes is blocked by the blood stasis. So the blood block on the pathway, which cause the body fluid cannot be distributed through the pathway. So if they can't be distributed, it will cause the water retention in that area. So that's the water retention due to the blood stasis. From the symptoms, from the clinical practice, you can see the patient have the heart problem, such as blood stasis. The example, very typical example is blood stasis in the heart, such as palpitation, difficulty breathing, chest pain. And in the meantime, the patient will have edema in the legs. So this is actually from our clinics. We can see this kind of symptoms on patients with heart failure. So the above are the discussion on the disorder of the body fluid. In the next video, we are going to talk about the internal 5 evils. Thank you, guys.